I had another patient who had contacted me because she read my book. She was living in Kansas City, and she said that she would wake up 3 or 4 times a night with this crushing chest pain, and she was having difficulty breathing, and so bad that she had to lay on the floor and labors breathing, and she was so bad. She went to the emergency room 3 times. They couldn't figure out what was wrong with her, kept sending her home, and then she was thinking she was not going to get out of it. And then she wrote up her will because she thinks she was going to die in her sleep. Well, she called me and she said, I've got this terrible chest pain. I just read your book. I figured it out. This is what's wrong with me by reading your book. And I need your help, but I can't get on a plane because I'm just stressed out. She said, look, don't worry. I'll come to you. And I treated her in her living room. In 5 days, after a lot of effort, she was much better, and she's been better ever since. So if you're having these like chest pains, if you're having difficulty getting a deep breath, if you feel tightness in your chest and you feel like sometimes like a pain in your armpit here, if you have pain in the base of your neck and pain between your shoulder blades, mid-back pain, then maybe the muscles that are in the pec minor, scalene, serratus anterior are so tight that they're twisting your rib cage into a state where you're having difficulty breathing. Then you're going to need to have whoever's treating you focus on going up underneath the pec major and treat the pec minor and treat the scalene muscles, and subclavius muscle also attaches to the rib cage, serratus anterior here that attach to the shoulder blade, and the muscles in the spine area to release the rib cage in the chest area. You're going to have to get adjustments of the ribs to get those ribs moving again because they're locked up. And if it's been there for a while, they're going to need a good adjustment. So that's another episode of the Thoracic Outlet TOS Tips by Team Doctors.